Risk of appendicitis after endoscopic full-thickness resection of lesions involving the appendiceal orifice, a retrospective analysis. Introduction. Endoscopic mucosal resection, EMR, and endoscopic submucosal dissection are highly effective techniques for resection of colorectal lesions. However, they have several limitations. In particular, EMR of lesions or laterally spreading lesions involving the appendiceal orifice is technically demanding due to difficult access to the appendiceal lumen and a high risk of perforating the thin cecal wall. Therefore, surgical intervention is often necessary. To allow definitive diagnosis and treatment, an endoscopic full-thickness resection, EFTR, device has been developed. It enables the endoscopist to perform EFTR with immediate defect closure. The system is suitable for resection in difficult anatomical places with high risk of perforation, such as in paradiverticular or paraappendicular disease. In addition, the prompt closure provided by the EFTR device has been described as minimizing the risk of peritoneal irritation during resection by shortening the contact time between bowel lumen and peritoneal cavity. To date, the largest published study dealing with colonic EFTR included 181 patients and reported R0 resection rates of 77.7% and 72.4% for difficult-to-resect colorectal lesions and early cancers, respectively. As EFTR affecting the appendiceal orifice is associated with subtotal appendectomy, it remains unclear whether the risk of developing appendicitis is increased. The aim of this retrospective study was to further evaluate the risks associated with EFTR at this challenging location. Background. Conventional endoscopic resection of lesions affecting the appendiceal orifice is difficult. Endoscopic full-thickness resection is a novel technique in interventional endoscopy. As EFTR near the appendiceal orifice is associated with a subtotal appendectomy, it remains unclear whether the risk of developing appendicitis is increased. The authors conducted a retrospective analysis of lesions involving the appendiceal orifice treated by EFTR. Methods. This was a multicenter retrospective analysis of 50 patients treated with EFTR for lesions involving the appendiceal orifice between 2014 and 2019. The objective was to evaluate the occurrence of appendicitis. Results. Acute appendicitis occurred in 7 patients, 14%, during follow-up. Conservative treatment was sufficient in 4 cases, and 3 patients underwent appendectomy. Conclusions. EFTR of lesions involving the appendiceal orifice may be associated with an imminent risk of developing appendicitis and a consecutive need for appendectomy. Patients should be informed about this specific risk prior to resection. It is unclear why some patients develop appendicitis while the majority remain asymptomatic.